Hello everyone, this is me, Dr.Rukmani, Choudhary, Endometriosis. So we will be covering everything about endometriosis. What are the signs and symptoms, what suffering you have while you have this problem, what are the diagnostic tests, and what are the complications if you read this problem, what allopathic mode of treatment, medical, surgical, and lastly, best effective top homeopathic medicine to treat endometriosis. First, the definition, what is endometriosis? The uterine part, the inner wall of the uterus is called endometrium, and the function of endometrium is it sheds off every month and you have periods. Have your menses on monthly basis. So if your endometriosis means that it deposited somewhere else outside of the uterine cavity, so this is called endometriosis. It can deposit anywhere, on fallopian tube, peritoneal cavity, peritoneum, on ovaries, so it can deposit anywhere and it can develop endometriosis. So this is how it happens. So what happens if the endometrial cells get deposited somewhere else? See, this is the function of endometrial cells, that on monthly basis, this is the hormonal change, on monthly basis it it sheds off and there is a bleeding. So if it is the case of endometriosis, means the endometrial cells are deposited somewhere else, bleeding will happen also. So but the bleeding, where the blood goes, see, normally in normal MC cycle, in your normal menses cycle, when there is a bleeding, when there is a shedding of the endometrium, it comes out through the cervix, through vaginal canal. But if it is deposited somewhere else outside of the uterine cavity, the blood does not go anywhere, it get deposited there, there is a bleeding, there is a scarring, so this create problem, there is inflammation. So this is how the case works with the time. So this is how it happens. Now we will be talking about the types of the endometriosis. See, broadly we will be talking, there are three types. The one is superficial peritoneal. When the endometrial cells they get deposited on the peritoneum. The peritoneum is a thin layer that covers your pelvic cavity, so it get deposited there, then it is called superficial peritoneal. And the second one is endometrioma. You might have heard about chocolate cyst. Why it is called chocolate cyst? Because it is a kind of cyst. Endometrioma means the endometrial cells are get deposited on the ovaries and they are fluid filled, they are dark fluid filled, that's why they are called chocolate cyst. And these chocolate cysts can damage the healthy tissue and you can have problem while conceiving, while getting pregnant. And deep infiltration. See, if the endometrial cells are deep infiltrated, they can infiltrate the surrounding tissue of the uterus, so they can infiltrate your bladder, your intestine. So then it's called deep infiltrating endometriosis. So what are the causative agent, what are the cause, what are the risk factors? See, there is no exact cause, there is no direct cause. Some theories are believed. The most believed theory we will be discussing is called retrograde menstruation. See, we have already discussed that if it is a normal menses cycle, normally the inner wall of the uterine cavity on monthly basis sheds off and you have your bleeding. Normally it comes out through your cervix, vaginal canal, and you have bleeding. This is the normal process. But in endometriosis, what happens? You are having endometrial cells outside of the uterine cavity, so bleeding will be there but blood goes nowhere, so blood get deposited. So it is believed that when you have this problem, endometriosis, so your blood despite going down into the cervix and the vaginal canal, it goes back to the fallopian tube and it can spill over there on your peritoneum. So that's why there is a spill of the endometrial bleeding and they can deposit it there and then they create endometriosis. So it is believed that it is the most believed theory. There are other theories as well, and this is also believed that it runs in the family. If your mother, your sister have, you can develop and it get worse with the generation. It is also believed that sign or symptoms of the endometriosis, like what suffering you have while you have endometriosis. See, there are cases are asymptomatic, means they don't have any symptom, so it is not necessary that you are having problem and you are having symptom. It is not possible. Some cases are asymptomatic. Now this, if the case is symptomatic, means that you are having symptom, what suffering you can. This is the case of endometriosis. So you can Dysmenorrhea means extremely painful periods you can have. So dysmenorrhea can be there, and there can be bleeding in your stool. You can have bleeding in stool, you can have bleeding in urine also, and there's a difficulty while you pass stool, you pass urine, there's a difficulty, and specifically around your menses cycle you have problem, obviously, and there are cramps. Usually in normal menses cycle you have cramps during your periods, but if it is the case of endometriosis, you have cramps around the menstruation cycle, means you are having before 1 week, you are having after 1 week. There are cramps that last longer in endometriosis. So these are the symptoms, and the most prominent symptom, you have pelvic pain, you have lower backache, you have symptom may vary from patient to patient, and there can be fatigue that does not resolve with the treatment. So now we'll be talking about there are the 4 stages broadly. The stages are depend that how severe is your case, how internally how damaged is your case, how severe is your case. So these are the 4 stages. For degree we call it categorized. Number 1 is minimal. As the name suggests, there are the lesions, there is no scarring, there is no adhesion. Now the second one is the mild one. Yes, you have lesions, there can be multiple lesions, but again there is no scarring. In grade 3rd, or we call it moderate one, there are deep infiltration. We already discussed deep infiltration means the surrounding tissue of your uterus. So it can be scarring because these are deep, and so there is a scarring, means adhesion can be there, right? So this is the 3rd stage. Now we will be talking about the 4th. For the scarring, they are the in between uterus, surrounding uterus, ovaries. Now we will be talking about the diagnosis part. See, it is not like that if you are having more symptom, so you must be having the severe grade. No, it is not like that. On the other hand, if you are having no symptom, it doesn't mean that you are having mild or moderate case. Symptoms vary from patient to patient, right? So diagnosis is based on your symptomatic collection, clinical representation of the case, like what is your case, what all symptoms you are having, your physical examination, your pelvic examination, and feel any kind of cyst, any kind of scarring. Your imaging test can be done, your ultrasound, your CT scan, your MRIs can be done to get a clear view of the organs, affected organs, and laparoscopy can be done. Laparoscope instrument that can be inserted by cutting a minor incision can be there, and laparoscopic study can be done for a further clear view, right? So biopsy can be done if it is required. Discuss the complications. See, the severe case, we discuss the 4th stage can be more complicated, and the most common complication is you're getting pregnant. There's a problem, infertility issues arises with the endometriosis. So the number 1 complication, others can be mental fatigue, because you have this problem for a longer period. There can be stress, there can be anxiety, long term patient can have depression for a long term. And rarely the severe one can develop endometriosis associated adenocarcinoma. Cancer can develop in severe cases if it is a severe one. Now allopathic, then the home treatment management, and lastly the best effective homeopathy medicine. See, in allopathy there are first there is a medical treatment by medicines, then by the surgical treatment. You prefer by going with the medicine, because there are so many medicines you can use in homeopathy as well. Before going to surgery, and medicines are given on your symptomatic basis. So if you have pain, you are given pain reliefs, painkillers, analgesics you are given, NSAIDs you are given, and if there are hormone therapies. See, we already discussed that this is the kind of hormonal influence, so hormone therapies are given to control that the monthly basis bleeding, to control that monthly, and surgery if it is required in severe cases and you are having problem while getting pregnant, so surgery you can go for surgery. But if it is a complicated severe one, in that case only, right? So home management, home treatment, you are supposed to be active, because your hormone will be proper, there will be balancing in the hormone, physically active, your diet should be balanced, proper. And if you have pain, pelvic pain, or you have dysmenorrhea, you can apply hot water bags, you can have warm bath, they can help you. Lastly, most important, homeopathy. See, why homeopathy, why you should choose homeopathy? Homeopathy is natural first, and it is side effect free. It is based on the holistic approach, means your whole case is taken and studied, and you are not given separate medicine for the separate symptom. Your all symptoms are collected, they are analyzed, they are evaluated, and on the basis of holistic approach your constitution is considered and your medicines are prescribed. Means what other problem you having, particularly with your case, if you have endometriosis, you are having fertility issues, you are having mental issues, you are having any physical issues. So this differentiate from one person to another. This is called individualization. So you can use homeopathy. So medicine you are supposed to, you are requested to use one medicine at a time. If you are having more symptoms and you cannot evaluate your medicine, then you can use more than one medicine, but at a gap of 10 or 15 minutes, right? And if you are watching on YouTube, there are link given on the description box of each medicine, right? Where which country you belong, which place you belong, doesn't matter. You just focus on the medicine name. That's it. That is important. The medicine name, it should be original one. So first we will be talking about the endometriosis with dysmenorrhea. You have endometriosis with painful periods. You can use homeopathic medicine xanthozylum, and there is a semicifuga medicine you can use, right? So now we'll be talking about the endometriosis with pelvic pain. The most common symptom of the endometriosis, pelvic pain in lower back ache, right? So Sabina is the medicine can be used while you have endometriosis with pelvic pain. Sabina is the medicine. 30 or 200 is the potency. 2 drops. You can have medicine with the help of droppers. Direct on tongue orally, 2 to 3 drops directly before meal, twice or thrice in a day, or for a regular period of a time, 2 to 4, 2 to 6 weeks you can have. If you have betterment in your symptom, you can discontinue. With the lowering down doses, you can discontinue this medicine. The next medicine is Pulsatiila. Yes, Pulsatiila is again given when you have endometriosis with pelvic pain, but Pulsatiila's character is Pulsatiila patient is restless. Pulsatiila, there is a chilliness, so Pulsatiila can be used. We skipped about the indication of the Sabina. Sabina is given when you have extremely backache, extremely labor-like pain. You have endometriosis, pelvic pain, and Sabina's pain are labor-like, excruciating pain when you have. And the Pulsatiila is like restless patient, 2 to 3 drops twice or thrice before meal orally for a regular period of a time, or you get improved, you can discontinue your medicine. CPR. See, if your case is endometriosis with dyspareunia, you have difficulty while intercourse activities, then there are two best medicine in homeopathy. Platina is given when you have high libido, and CPR is given when you have low libido. So CPR can be used in dyspareunia, difficult intercourse activities. Again, 2 to 3 drops twice or thrice before meal orally for a regular period of a time. You can cutting down with lowering down doses. Like if you are using thrice, you can use twice, once, and then you can discontinue rather than discontinuing all of a sudden. So it is advised, taper down your dose and then discontinue your medicine. Lachesis. See, in the symptom we discussed that you have bleeding per rectum, you have bleeding in a stool. So Lachesis is the medicine when you have bleeding in a stool. So 2 to 3 drops twice or thrice before meal. See, you can see the color difference of the medicine. So this is the different company, this is the different company. So company can be anything, but medicine name, you just focus on the medicine name Lachesis. 30 or 200, 2 to 3 drops twice or thrice again before meal orally, 2 to 3 weeks, or stool. Now Natrium. See, you have bleeding in urine also, we discussed in the symptoms. So if you have bleeding in your urine, then Natrium is the medicine. In endometriosis cases, like your case is endometriosis, then you can use Natrium. Start with the lower potency, 30 is the lower, 200 is the higher, and there are higher potency. Use Natrium 30, 2 to 3 drops twice or thrice before meal. If you get improvement earlier, then you can discontinue your medicine earlier. It is not fixed that you have to continue your medicine for a longer period. If it is required, then continue for a longer. If it is you get improved, then you can discontinue your medicine earlier also. So it is not fixed in homeopathy. Like first is the medicine which is given when you have dysmenorrhea. You might have heard about Macphos, is a quite famous well-known medicine in homeopathy for dysmenorrhea cases. This is in the tablet form. So you can have this medicine, you can mix it with lukewarm water, 2 to 3 tablets. This is SOS medicine. Whenever it is required, you can use this medicine. Once you get improved, you can discontinue the medicine. If you have pelvic pain, if you have dysmenorrhea, excruciating, a painful period, you can use this Magfos medicine, right? So the all link are given on the description box. You can check description box. We are having one syrup also, the female tonic. We are having Mensol. See, Mensol, this is the Mensol syrup, and it is given when you have extremely pelvic pains, right? See, it is written, it is very effective medicine in the pelvic pain. If you are having pelvic pain is the main character of endometriosis, so this medicine can be used. 1 teaspoon you can mix with the water. You can have without water even you can use, and you can use it twice or thrice before meal orally for a regular period of a time. So these can be videos can help you. If you find these videos informative, knowledgeable, you can share, you can like videos, you can subscribe our channel, you can press the bell icon to get notified.